It's been a minute. How are you guys doing? I can't remember when last I came on this space too. I just finished a live. By the way, if you're seeing this video, go and watch my live video. It's on my live section and I talked about stroke. Today is the um 29th of October, which is basically known as World Stroke Day all over the world. And this is a reminder that stroke is not a death sentence. Stroke is not village people. It happens, and there are ways to prevent it. There are some lifestyle to maintain, and when it happens, there are things that can be done to, you know, save your life or save one's life. So it is not village people. It is not. If I start to tell you things that I've actually experienced or seen in the hospital when it comes to stroke and what people actually say about them, the ideas they have about stroke, it is. I don't want to use the word crazy, but it is unbelievable. So from the title of this video, I already know the what I want to do. So in my live video, I said I was going to do like NCLEX review questions on stroke, but I wasn't able to do it because I wasn't even sure. I've not done live before, so I wasn't even sure that I was doing the right thing. If people could even hear me or anything, but it is there. I just wanted to try for the first time since I hit 1.6k subscribers. 1.6k subscribers for someone who has not been consistent, who has not really been putting out videos since months. And I'm at 1.6k subscribers. And thank you all for subscribing. And this is me. Should I make a promise? I won't say I'm making a promise, but this is me saying I'm back to putting myself out there, back to making videos actively. It might not be every day, but at least in a week you should expect something, right? Um, so I'm very big on growth. I'm very big on learning. I'm very big on academic improvement. I'm very big on career. I'm a career person, to be honest, and I also want to see you excel in your career. I want to see you win, and this is my. That's why I'm making this video, and I'm like, Joe, I need to put yourself out there. Put yourself out there. A lot of people. I know a lot of people can relate with me on this, but I'm a very. I don't even know if I'll say I'm an introvert or I used to have this like call it imposter syndrome. Like, what do you even know you are doing? That kind of thing. What do you even know you are doing? What do you know you want to do? But I know I want to reach out to as many people as I can. And so I'm here putting myself out again. So like I said, today is World Stroke Day, and sorry, I will be taking questions, we'll be reviewing questions together about stroke, especially when it comes to the NCLEX exam, how to answer questions, how to use rationales to answer questions. So as registered nurses, you're supposed to have your rationales, your scientific thinking when answering questions. You don't just want to answer questions just like that. Yeah, so I'm going to be going through the questions I have here. I'll be reviewing them together with rationales. So our first question says, a patient arrives at the emergency department with the following symptoms of a stroke that began an hour ago. Which of the following is the nurse priority action? First of all, administer oxygen at 4 liters per minute via nasal cannula. Number 2, prepare the patient for a CT scan. Number 3, obtain a blood glucose level. 4, insert a Foley catheter. So which of these do you want to do first? So when it comes to priority action, there are a lot of things you need to consider. First of all, airway breathing circulation. Secondly, you want to consider if it's an acute condition over a chronic condition. You want to consider if it's a systemic problem over a local problem. There are a lot of things to consider when it comes to priority action. So I think that is a video I will do separately on its own, prioritization and delegation when it comes to the NCLEX. So Now, in this scenario, patient arrived at the ED with symptoms of a stroke that began an hour ago. When it comes to symptoms of a stroke, there's an acronym: be fast, um, B, which is balance, E, which is eyes, F, which is face, A for arm, S for, what's the S again? For slurred speech, and then T is for time. So these are the symptoms of a stroke. Now, when it comes to this question, administer oxygen at 4 liters per minute. The question did not tell you the saturation level of the patient, right? And the question did not say, oh, patient is at risk of, how would I put it? The question didn't say patient saturation level is low or patient is finding it difficult to breathe. Do you get? So administering oxygen at 4 liters per minute. Why are you doing that? In as much as ABC is very important in priority, but why are you doing that? Prepare the patient for a CT scan. This is the first thing that is done when a patient presents with the symptoms of a stroke. And why are you doing that? Because you want to find out the kind of stroke. So the first thing to do is a non-contrast brain CT. Remember, time is of essence when it comes to a stroke. So you want to know if this patient has an hemorrhagic stroke or ischemic stroke. Ischemic stroke, you can give TPA and all of that, and the stroke can be reversed or managed and patient gets better and go home. When it comes to hemorrhagic stroke, there is a bleeding in the brain and you don't want to give TPA because it will cause further damage. TPA is thrombin plasminogen activator, and it is a thrombolytic. It dissolves the clots, it breaks that clot, and you know what happens next? Bleeding. So you don't want to do that. So you need to be careful. Do a CT scan ASAP. So that's why B is the answer. Why is obtaining a blood glucose level not the answer? They didn't tell you patient is hypoglycemic or patient is hyperglycemic. Like I said, read what is the question. Don't overthink it. Don't assume. Don't use what you're seeing in your hospital to answer the question. In as much as, yes, your experience matters, and some of the scenarios in the hospital helps you to know what to do, but don't assume. That's just what I would say. Don't assume. Just read the question and answer the question the way you see it. Insert a Foley catheter. Why are you inserting a Foley catheter? Is patient having urinary retention? No, it wasn't mentioned in the question. They never told you patient has urinary retention, so please be careful not to pick that as your answer. So the answer is prepare the patient for a CT scan. Remember, time is of essence when it comes to stroke, and you want to distinguish between ischemic and hemorrhagic. For ischemic stroke, there is a blood clot obstructing the flow of blood to the brain. For hemorrhagic stroke, there is a bleed in or around the brain. So that's the difference. Yeah. So the second question we have here says, which of the following assessment findings would indicate that a patient with an ischemic stroke is experiencing a complication? So there are different complications when it comes to ischemic stroke, but let's look at the options. Number 1, difficulty speaking and understanding language. Number 2, hemiparesis on the affected side. Number 3, sudden severe headache and vomiting. And 4, loss of coordination and balance. Which of these indicates that a patient with an ischemic stroke is experiencing a complication? So you know what complications are? They're like after effects of a problem. So the answer here is what? Okay, let's go through it one by one. First of all, the question says difficulty speaking. The answer says difficulty speaking and understanding language. So you know that one of the signs and symptoms of a stroke is aphasia. Will I call it a signs and symptoms, not a complication actually? But one thing you should know is this: aphasia comes after a stroke for some people. And what is aphasia? Difficulty in speaking and understanding language. So there are different types. We have the expressive, we have the receptive. That's story for another day. But difficulty speaking and understanding language is not the answer. Hemiparesis on the affected side. Normal, when a patient comes out with a stroke, there is always a disability on the affected side. So how the brain works is, if the right is affected in the brain, physically it shows on the left. If the left is affected in the brain, physically it shows on the right. So what am I trying to say? If there was a stroke on the right side of the brain, you're going to see the manifestation in the left side of the body. If there is a stroke in the left side of the brain, you see the manifestation in the right side of the body. That's what I'm trying to say here. So it is normal. Let's say it is normal, or it comes with a stroke, hemiplegia. Now, sudden severe headache and vomiting. From the sudden, you're supposed to know that, oh, this is the answer. And why did I say that? So when answering NCLEX questions, there are methods to do that. You might not even know the answer, but there are some keywords, some key points, some subtle words that should come to mind, if I may say. So now when it comes to sudden severe headache, like I told you, in prioritization, we have the ABCs, we have the acute over chronic, we have the systemic over local. We have, when it comes to operation, we have from the first hour to the 12th hour of to the 24th hour of surgery. Anything from 2 to 4 days and up is no longer a problem. Do you get? So now, here says sudden severe headache and vomiting. Sudden, what does it mean? Acute. It just happened. Now. Immediately. Do you get? So that is the answer. When something happens suddenly, you know that this is a very, very big problem. Like just all of a sudden, severe headache and vomiting. That's a sign of what? Increased ICP. Very, very easy and demure. Sorry. So this is very, very easy. So now it means that this ischemic stroke might be turning to an hemorrhagic stroke. It actually happens. Yes, it happens. A patient might come down with ischemic stroke, and the next minute that ischemic stroke has become an hemorrhagic stroke, increased ICP due to what? Cerebral edema, and all of that. So the answer is sudden severe headache and vomiting. So whenever you see the word sudden in a question, in an answer to a question, always suspect that answer, that it might be the answer. So like I said, a sudden severe headache and vomiting can be a transformation of the ischemic stroke towards to hemorrhagic stroke. So that is the answer, and it needs to be reported ASAP. You need to call the HCP, the healthcare provider, call his or her attention, and so that the next line of action will be taken. So the third question says, a patient with a history of atrial fibrillation is at risk for which type of stroke? A patient with a history of atrial fibrillation is at risk for which type of stroke? A, ischemic embolic stroke. B, ischemic thrombotic stroke. C, hemorrhagic stroke. And D, transient ischemic attack. Ischemic embolic stroke. So from the word embolic, you already know that, formation of blood clots. So A is the answer, and I'm going to explain why. Ischemic embolic stroke, so atrial fibrillation can lead to formation of blood clots forming in the atria of the heart. And when this happens, when there is blood flow, it can take that clot straight to the brain. You get? So now it can travel to the brain and cause a stroke. So that is why when a patient has atrial fibrillation, you want to be careful not to just leave that patient. You need to start thinking of medications like rivaroxaban, apixaban to make the blood loose. I'm trying to break this down in a way that you understand. To make the blood not so what's the word now? I'm looking for a word. Not so viscous, if I may say. Not so viscous, you get. So you're trying to make the blood not so viscous, to be able to, so that the blood can be able to go through the vessels of the heart without forming a clot and causing an ischemic thrombotic stroke. So A is the answer. Sorry, ischemic embolic stroke, if I may say. Then the fourth question says, a patient with right-sided hemiplegia and expressive aphasia is being discharged home after a stroke. Which instruction is most important for the nurse to provide to the patient's family? A patient with right-sided hemiplegia and expressive aphasia is being discharged home after a stroke. Which instruction is most important for the nurse to provide to the patient's family? A. Encourage the patient to do all tasks independently. B. Limit verbal interactions with the patient to avoid confusion, frustration. C. Provide written communication boards or picture cards. D. Feed the patient on the left side to prevent aspiration. So let's read through the question again. A patient with right-sided hemiplegia and expressive aphasia. Right-sided hemiplegia, the right-sided is affected, right? Expressive aphasia, this patient cannot actually tell you what he or she wants. You can't understand what he or she wants. The patient might be trying to say something, but you cannot understand what the patient wants. So now this patient is being discharged home after a stroke, meaning what? That all the things that should be done for this patient have been done, and this patient, and stroke is not something that you recover fast. Pion. This is something that takes time. So obviously, with the way the question is put, it means curative measures have been taken and patient is now discharged home, but still patient has right-sided hemiplegia and still has the expressive aphasia. So it's going to take some time for the patient to get his or her speaking abilities back. Sometimes some of these patients don't even get the ability back. They just live with it. So now this patient has been discharged home after a stroke. So which instruction as a nurse are you supposed to provide to this patient family? And it is important that you tell them. A. Encourage the patient to do all tasks independently. Really? This patient is at risk for fall. And when this patient falls down, you know what comes next. You don't do that. You have to actively, in as much as you want this patient to participate in activities of daily living, you also want this patient to not to do all of his tasks independently. You have to be there to help. You have to help this patient because this patient has right-sided hemiplegia. It's very simple. B. Limit verbal interaction with the patient to avoid frustration. Why are you being frustrated? This patient is sick. So why are you being... In fact, you're not the person in question here. So why are you being frustrated? You don't limit verbal interactions. Rather, you actively engage the patient, to help the patient regain his or her speaking abilities. C. Provide written communication boards or picture cards. If you were attentive, you remember when I said that this patient has expressive aphasia and cannot express his or herself verbally. The patient cannot be able to tell you what he or she wants, except when it comes to communication boards or a picture card. Then now you show this patient a picture, maybe the patient wants something, you're trying to understand the patient, right? To an extent, you might understand what this patient is saying, but to confirm what this patient is saying or what this client is saying, you provide picture cards. You can write down something on a paper or whatever and show this patient. This patient can actually understand these picture cards. Patient can actually understand what is being written and shown to him or her. But patient cannot actively express himself to you. So now you're showing this patient the picture card or the communication board, and patient can now nod yes or no, or point at what he or she wants. So that is the answer. Provide written communication boards or picture cards. Now the other question says, question 5, we're on the 5th question. When teaching a patient with stroke risk factor, which lifestyle modification should the nurse emphasize to help prevent a stroke? I don't want this video to be too long, okay? So we still have time. It's going to be like a 20-minute video. If I can entertain 10 questions, very good. When teaching a patient with stroke risk factors, which lifestyle modification should the nurse emphasize to help prevent a stroke? Reduce fluid intake to avoid high blood pressure. Does high blood pressure have anything to do with fluid intake? I don't think so. Engage in regular aerobic exercise. Can exercise prevent a stroke? Follow a high protein diet to strengthen muscles. From what I know about protein diets, they are bodybuilding. Yeah. So I don't see how it helps to strengthen muscles. Rather, I would have said carbohydrates, high carbohydrate diet to help strengthen your muscles because they are energy giving food, right? Limit activities that require focus. What does that even mean? The answer to this question is engage in regular aerobic exercises. Okay, so when sorry for the breaking transmission, my phone was showing it's too hot. My phone was showing that the temperature was too high and I needed to stop the video to allow it to go, and that was what I basically did. So I think we'll just be answering the fifth question and that will be all for this video. So as I was saying, when it comes to so as I was saying, when teaching a patient with stroke risk factors, okay, the question says when teaching a patient with stroke risk factors, which lifestyle modification should we not emphasize to help prevent the stroke? So first of all, the first one says reduce food intake to avoid high blood pressure. Second one says engage in regular aerobic exercise, follow a high protein diet to strengthen muscles, limit activities that require focus. So I said there's no way fluid intake has an effect on blood pressure, if I may say. Engaging in regular aerobic exercise is actually the answer. So you want to exercise your body. You want to teach this patient that exercise will actually help, with the muscles, with everything about the patient, basically helping blood flow, circulation and all of that. Following a high protein diet to strengthen muscles. So a protein diet does not strengthen muscles, so to say. I would rather, I didn't mean it was follow a high carbohydrate diet. It would have been better because a carbohydrate diet is an energy giving food, right? So limit activities that require focus. I don't know what that means, but that's definitely not the answer. So the answer is engaging in regular aerobic exercise. So you want to engage in regular exercises which will help, strengthen your muscles, aid in circulation. Basically, it will help prevent a stroke. So that will be all for today on NCLEX review question and answers on stroke. If you want more of this video, I am open to it. You can do this, and yeah, I'm your body on excellence. I'm your body on success, on passing your NCLEX exam. So if this is a video you like, please give it a thumbs up, like, share, subscribe, share to your friends, share to people who you think need this video. And I wanted to say something else. So if you want free tutorials or classes on the NCLEX and topics, content, I'm going to drop my Telegram link on this video. You can check the description box for the link. I have a Telegram group, Nursing with Annie on Telegram group, where I do free reviews, question and answer, content, and all of that good stuff. So yeah. Also, I think I'll open a WhatsApp for one too, but for now we're on Telegram. You can, reach out on Telegram and we'll pick it up from there. So yeah, keep reading, keep studying. You're going to pass these exams, and this is me just trying to pray for whoever wants to take the NCLEX exam. You feel overwhelmed, you feel like you don't know where to start from, you feel like you're reading and you're not understanding the questions and the answers, you don't understand the rationale or they don't stick. I pray that God helps you, that the spirit of wisdom rests upon you, and that the spirit of God dwells in you. The Bible says that He's the one who causes us to know all things, and I ask that God helps you. As you study, you will always remember, just like Daniel, you would always remember what you study, and God will give you the wisdom to navigate through this process and season of your life. In Jesus' name, amen. So I'll see you in my next video. For now, ciao ciao, bye.